All right, welcome to Apex Benefits first webinar of 2024. I am Andrea Hickel, licensed clinical social worker, and I am here with...
I'm Catherine Kirchhoff, Director of Kinetic Health here at Apex Benefits. Today we are talking about combating seasonal depression. So just a couple webinar housekeeping items. All attendees will be in listen-only mode for the duration of the webinar. If you have questions or comments, use the chat box located in the right-hand side of your webinar screen. We have someone monitoring that for us. For audio access, attendees can use computer audio or call in using the phone option. And then the presentation slides and resources can be downloaded by clicking icon on the right-hand side of your webinar screen.
Awesome. So going into what we're going to be discussing with you guys today, we are going to be talking about signs and symptoms of seasonal depression or SAD. We are going to be going through some effective strategies for managing your mood, especially during these winter months. And then I'm going to turn it over to Catherine, and she's going to talk about some tips for staying active, some healthy eating choices, how that can impact our mood, and then creating a cozy and supportive environment while at home. And then we will have time for some questions there at the end. Awesome. So starting off with, what is seasonal affective disorder, or SAD? Seasonal affective disorder is a mood disorder that's characterized by depression that occurs the same time every year. It tends to happen when we have less sunlight out or the change in seasons. But something that I did realize when doing research about seasonal affective disorder is that it doesn't only occur in the winter. A lot of times we think about it happening just in the winter months, and it is most common in the winter months when it gets colder, when we see less sunlight, but it also can happen in other changes of seasons. So that's something to note, that if you find that every year, going into spring or going into fall, you notice yourself experiencing some of the symptoms that we're going to talk about here today, that might also indicate seasonal affective disorder as well. But today we are going to focus heavily on winter and what it means for that.
Yes.
So moving into, what are some signs and symptoms of seasonal affective disorder to look out for? So a lot of the signs and symptoms are going to be those that you would see in just your standard depression, right? So persistent sadness, anxious thoughts, feelings, feeling guilty, worthless, helpless. So a lot of those same signs and symptoms will exist within seasonal affective. You just may not know why you're feeling that way. And so that's something definitely to look out for, especially if there's not something that happened or something that may cause you to feel sad or down, anxious a lot of the time.
And something you mentioned to me was the persistency of it.
Yeah.
So, sometimes you can have an off day, maybe an off couple days due to an event occurring, or just maybe lack of sleep, something along those lines, but this is persistent, going on 2 weeks.
Yes. Yeah, so that is a big difference when we're looking at diagnosing a disorder, is that it's something that would last at least 2 weeks, and you would have these symptoms every day throughout that period most of the days. Whereas, we might have some rough days where we do feel sad, but it's not going to last that long. So that's definitely something to look out for as well. Another thing to look out for is change in sleep and appetite patterns. That's another common sign and symptom of depression overall, but something especially in the winter months to look out for. We can sometimes get caught into quote unquote hibernating, where we find that we want to stay in our bed for long periods of time. We want to sleep longer, but that's definitely could be a sign or symptom of seasonal affective disorder, as well as changes in eating patterns. So of course, with depression, you're going to see maybe some symptoms of loss of appetite or an increase in appetite. Those can both take effect, but a lot of times in these winter months, we might start to crave some of those carbohydrates or more comfort foods. Yeah. And so if you notice that, that's something else to look out for specifically with seasonal affective. And then another big thing to look out for is social withdrawal, which once again, we're in the dead of winter. It can be hard to get out. It can be tempting to just stay at home, which there's definitely some positive things when it comes to that as well. But it's important that we're still having social interaction. So maybe that means that you're still doing phone calls or FaceTiming with people, interacting with people in your homes, playing games, or just having people, to the home instead of going out. Whatever that may mean for you, it's important that you're still engaging in that. And if you find that you're withdrawing from all people, that can definitely be a sign or symptom that you might be suffering from seasonal affective disorder. So now looking at what are some potential risk factors that would increase the likelihood of seasonal affective. With any sort of mental health disorder, you're going to have your genetic factors that play a risk, and then you're also going to have your environmental factors. And so it's just the same here with seasonal affective. When we look at specifically in the winter, but also changing other seasons as well, reduced levels of sunlight disrupts your body's internal clock and lead to those feelings of depression or feeling more down. And so that's definitely a risk factor. The times of year where our days are shorter, we're having less sunlight, that's a huge risk factor. When we also change the season, it can disrupt our balance and our body's levels of melatonin, which can lead to disrupted sleep and impacting our sleep, like we talked about, maybe an increase in sleep or trouble with sleeping, but that affects our overall mood in general.
Especially during the time change.
When we're changing time.
Fall back, spring forward.
For sure. So that's another kind of environmental or external thing that can increase the risk. And then also vitamin D deficiency, which goes along with we're not getting as much sunlight. That leads to exacerbated problems when it comes to feeling sadness, feeling like fatigue, not motivated to get out and do things. All of those things are definitely some risk factors to look out for, as well as, again, the genetic and kind of predisposition things of if you already struggle with depression, if you already struggle with another depressive disorder like bipolar, that's something else to look out for. So now, as promised, what are some effective things that you can do to help manage your mood if you do notice that you're struggling or just in general, right? This is a great time of the year. January, we're setting lots of goals, starting fresh. So what are some things you can do? One of the first things that I put on here was to seek help early on. I think, again, start of the new year is a great time to say, what can I do to better my health, to take care of myself, to do some evaluation. And so, especially when it comes to our mental health, managing our mood, I think a great thing to do in the new year is to look at, does my company offer an employee assistance program? A lot of times, companies will offer employee assistance programs where you can get free therapy sessions up to a certain amount. You can also get some work-life resources, which is really helpful as well. And so I think a great thing with starting early is maybe you just try out your employee assistance program and you talk to them about goal setting. You say, it's a brand new year. Here's some things I want to work on. And that way, if you are struggling or you notice that you have some of these signs and symptoms we discussed earlier, you have somebody you can reach out to.
Well, and it's usually the time of year we go for our physicals anyway. Mm-hmm. A lot of times people don't think about the holistic point of view of including your mind in that. Yeah. If you're going to have your labs drawn, you're talking to your PCP about your physical health, why not set up those free visits with your EAP to talk about your mental health?
100%. So that's one of the first things. Another thing is going to be light therapy. So this is a big thing that's recommended when discussing seasonal affective disorder. And a big reason for that is that a lot of the risk factors is the decrease in sunlight and that vitamin D. And so with the light therapy, you're not going to get, that vitamin D necessarily, but you will get some of those same feelings through those lights. And so there are different therapy lights that you can utilize, or just paying attention. I know Catherine's going to talk about it a little bit later, to the lighting in your home that allows some effects of artificial sunlight, and can help to increase your mood there. So that's another thing that you can take advantage of in the new year. Another thing is to make sure that we are establishing and maintaining good routines. That is so crucial and key overall for our mental health, for our mood, but especially in the winter months coming off the holidays. We may be super busy, kind of out of our normal routine because we've been going into events and things with friends, and we're exhausted. We want to stay in, right? And that's acceptable. But it's also important that we're maintaining good morning and evening routines. Those will really help to keep our sleep in balance, keep us on a good schedule there. And also, it's just going to help create a semblance of normalcy. So allowing for other ways to engage in social interactions as a part of that routine, incorporating that in, which goes into the self-care piece. I'm going to always preach self-care. It is very important that we are practicing holistic forms of self-care, which we're going to discuss a little bit more, some other ways that we can take care of our physical health, but really evaluating, are you doing things that fill yourself up? Are you engaging in activities that help to relieve some of that stress for you? And that's going to be so individualized. It's going to look different for everyone. So the first step with self-care is to evaluate that for you. What does that mean for you? Maybe for some people that means, doing a bubble bath a couple of times a week. Maybe for others that means really engaging in trying a new workout class. Reading books. I know that's a huge one that people like to do in the new year as well. So figuring out what self-care works best for you, and then adding that into the routine that we talked about. So you have your normal routine. How can you add in those different things that are important for self-care into that routine? And also, again, I'm going to keep reiterating, making sure that you're having engagement with others as a part of that, even if it is, just a phone call or some virtual engagement, hanging out with coworkers, whatever it may be, adding that in as a part of your self-care is crucial as well.
Well, and I think too that you said adding the self-care into your routine.
Yeah.
It doesn't have to be something extravagant. Every night you get your self-care. But setting those goals of once or twice a week can go a long way, because otherwise it gets put on the back burner.
100%.
Especially when you're working full time, you've got a lot going on. If you don't set that time, it may not happen.
100%. And making it realistic for you. Right? Like, don't set your standards of, I'm going to do this 6 days a week, when that's not realistic.
Right.
So I think that's a great point as well. And then the final tip for managing mood is vitamin D. As we've mentioned, a decrease in vitamin D is a big reason that people struggle with seasonal affective disorder. So finding ways that you can finding ways that you can add in that vitamin D is crucial. And Catherine's going to talk a little bit more about that, as some natural ways that we can add that into our diet, and also consult with our providers about that as well.
Yeah, absolutely. And something to add too, if you are going to your annual physicals here in 2024, you can add a vitamin D lab to your normal lipid panel, your biometric screenings that you normally do. It could be an additional cost. So that's something to check with your insurance on and to talk to your provider on. But that way you can see where your vitamin D is falling. And if you do have low vitamin D, then your physician can recommend a supplement that may work for you. When you're adding a supplement, it's always key to discuss that with your physician. Okay, so starting off, we talked about what you should be looking for, and Andrea provided some mental health tips, but what are some things we can be doing, nutrition-wise, physical activity-wise, our environment? So we're going to kick off with food. We tend to separate our brain from the rest of our body, but good health means good health from a holistic perspective, head to toe. And I don't think a lot of people realize that our GI tract is often referred to as the second brain. So what we eat, especially foods that contain a lot of chemical additives, processed foods, that can disrupt that environment and can increase our risk for lots of different diseases, which we know about: obesity, type 2 diabetes, high cholesterol, high blood pressure. Those are the things we know about. But what is not as known is that 90%, 95% of our serotonin receptors actually live in our gut. So when that environment is thrown off by the foods we are ingesting, that's causing our serotonin to decrease, which of course affects our mood in the long run. So Harvard did a study in 2021 to try to focus on what diet may help our mood the most. Unfortunately, with all the different kinds of lifestyles and risk factors, they couldn't pinpoint just one thing. For instance, you can't just focus on food if someone also isn't exercising, or they may be a smoker, or depending on alcohol consumption. Of course, genetics too all play a role. So you can't pinpoint just one factor that may be causing depression. So they couldn't just link food to that. But something to consider is that there was a good link to show that by eating whole foods, it was able to increase mood. And one diet in particular was the Mediterranean diet, which actually I think the last couple of years has been voted on the best diet to follow for your health. So the Mediterranean diet is whole foods, and what I like about that diet is you're not necessarily cutting anything out. You can still have carbohydrates. You just should be focusing on things like whole grains, fruits and vegetables, lean meats like chicken and fish. Trying to stay away from the red meats as possible, like unhealthy fats. But the people who were eating more of a Mediterranean style diet had a lower risk of depression. So this was all in that 2021 study. So what are some tips you can do to kind of start adding those things into your diet? Definitely eating enough fiber. We talked about the importance of gut health. While adding fiber into your diet is definitely one step to take, and including whole grains and legumes in your diet. So let's say you're getting about 6 servings of carbohydrates a day. 3 of those should be whole grains. Things like whole grain bread, brown rice, whole grain tortillas. Picking those options over the white options just because they're more processed, but giving you more sugar in your diet. And then, of course, including probiotic-rich foods, such as plain yogurt, without the added sugars. So a lot of times you can buy those Greek yogurts, but they have the fruit or the flavor mixed in. Well, that's where that added sugar is living. So by adding plain yogurt, or buying plain yogurt, and you add your own fresh fruits, your own honey, whatever you like to add, you know what you're putting into it when it comes to added sugars.
I love that tip.
Yeah, that's a good one. Eating whole foods and avoiding packaged or processed foods, which are high in unwanted food additives and preservatives, which we talked about, can kind of throw off that healthy bacteria in our gut. So as much as possible, we're not saying never. You're never not going to have your chips. You're never not going to have the processed foods. It's just moderation. If you can cut it out to maybe a couple of times a week, things like that you know you can achieve and you can maintain. And instead of vegetable or fruit juice, consider increasing your intake of fresh fruits and vegetables. But something I think is important to point out, all forms do count. Frozen, canned, fresh, especially right now. Not a lot's in season. It's hard to find fruit that'll actually last, that actually looks decent. So if you're buying frozen, my tip is to avoid anything that's sitting in any sort of sauce, because again, that's where that sugar and sodium is living. Just buy plain old frozen veggies and then season it with flavors you enjoy, seasonings you enjoy. And then if you're buying canned, a lot of times you can buy low sodium options, and you can also just rinse them really well to try to get any of that extra sodium that may be on the canned veggies. So what are some important vitamins and nutrients you should be including in your diet that are known to increase our mood? Low levels of these vitamins and nutrients are associated with worsening mood and decreased energy. So zinc, especially right now this time of year, zinc's really good if you're fighting a cold, it's COVID, flu, RSV season. Zinc's really good to throw in to kind of help fight that germ faster. Things you can eat: nuts, mushrooms, meat, vegetables. Iron If you have low iron in your diet, you know that it can cause fatigue. So finding ways to increase your iron, almonds, dark leafy greens like spinach and kale, walnuts, chickpeas, B vitamins, especially B12. B12 is really known to help boost your energy. So things like eggs, fish, nuts, almonds, fruits, and veggies. Magnesium is really good. It's a natural mood booster, and it also can help with sleep. So if you're fighting some insomnia, that's an option, to talk to your physician to see if adding a magnesium supplement could work for you. Dark chocolate, so there is some sweet treats in there. Avocados, legumes, and seeds. And then, of course, vitamin D. We've talked about it multiple times. But the best way to get these vitamins and nutrients is through our diet, through our food. Supplements aren't always going to give us the best form of it. So if you can get the vitamin D through fish, eggs, and dairy products, that's a great way to get it. Mm-hmm. And then, of course, omega-3 fatty acids, so important for our brain and cognitive health. Salmon, tuna, almonds, olives, and spinach. If you're not a fish person, this is also something you could talk to your doctor about adding into your supplements to see if that could, help with adding the fatty acids in.
Yeah, I definitely love how these are just some whole food options that you can add in, because I do think a lot of times we go to, okay, well, let me just get a bunch of supplements, right? But there's a lot that we can just kind of switch up with our diet that might not be a big lifestyle
change. And it's the best form to get those vitamins and nutrients.
Yeah.
And when you look at this list, mimics exactly what the Mediterranean diet is. Mm-hmm. So it kind of goes hand in hand to the importance of just really paying attention to what we're putting into our bodies.
For sure. Yeah.
So we talked about food and nutrition, and then, of course, our physical activity. And once again, we know that food and nutrition and physical activity play a role in our overall physical health. But I think we put the mental health in the back burner on the importance of physical health. It's important for our mental health too, or the physical movement. So there is research that shows 30 to 60 minutes of exercise a day can help manage or avoid SAD, so seasonal affective disorder. So regular physical activity helps you feel better in general, improves your balance, improves your bone and muscle strength, can decrease your risk of certain diseases, maintain or lose weight if that's something you're trying to do, but also can help keep your mind sharp. So if you are a person who enjoys working out outside and you're going to continue to work outside in the winter, things to consider is, of course, layers. The layer of clothing that's closest to your body should be moisture wicking, and then the layer on the outside should be, if it's raining, like a rain jacket, something along those lines. And then if you can't get to your workouts till super early in the morning, or if it's later at night, making sure you're wearing bright colors, a reflective vest, some sort of flashing light, especially if you're walking a dog.
Yeah.
I've seen some of the flashing lights on the collars because sometimes you can't see them. So just making sure people can see you, especially if you don't have sidewalks in your neighborhood. And then there's other opportunities. If you're not going to exercise in the cold is not for you. Some tips: mall walking. Mm-hmm. It gets you out of the house.
I love that one.
Yeah. If you need to get out of the house, you just need to see other people. That's an opportunity to get out, exercise in a warm environment. If you want to join a gym just for the winter season, they have indoor swimming. There's water aerobics. There's group classes if you like to exercise with others. And then if that's just not in your budget and you want to set up an at-home workout area, and the thing is you don't even really need to buy workout equipment, maybe just a yoga mat, and you can use your body weight. And a lot of times you can just look up quick YouTube videos, 10-minute ab exercise or a 30-minute walking exercise, something along those lines that you can do at home.
100%. And I think another thing with physical activity going hand in hand with self-care is that it needs to be individualized to you and it needs to be something you enjoy.
Yes.
Right? So, if I hate running in the cold, I shouldn't be running in the cold. No. I should find something that I do enjoy. Yeah, which is why I love the mall walking example, because that's a way to get outside the box, still getting your physical activity, and doing it in a way that's enjoyable for you.
Yes. And then, of course, avoiding the social hibernation. So CDC and Mayo have both done research in the importance of staying socially connected. You can't forget about your emotional health and your social well-being. relationships can lead to overall better health and improved well-being. It's easier to cope with things like if you're going through a hard time, someone in your family's sick, stress, anxiety, depression. It's important to be able to have a group to lean on if and when you need that help. And it's easy to get in a rut in the winter. So tips are just like Andrea said, include it in your routine. You have a standing date with your group of girlfriends to grab coffee on Saturday morning, or you have your walking crew up to meet at the mall. And if you're needing help and you're needing ideas, maybe to meet new people, finding your local community center. Are they putting on free events like a sewing club, a book club? Are you part of a faith-based organization? Is there something you could be doing at church? Really making sure you're making effort to be around others. Oh, and for those who are working remote, this was a good question my coworker brought up, because a lot of people post-COVID never went back to the office. And so you miss that social interaction with your coworkers. That's a big social interaction. So, setting time. Do you put 30 minutes once a month with your team on a Teams call and eat lunch? Talk about each other's lives, how everyone's doing, having a Teams social hour, happy hour, something along those lines, or finding a workspace where you can just join their Wi-Fi and just be around others. You never know who you may meet in that situation.
That's a bad idea.
And then creating your safe space at home. So first of all, decluttering. Clutter for me is very much, it triggers anxiety. Yeah. I'm known to lose my phone and keys quite often in my house, but I should be able to put them in the same spot every single time. So making sure your countertops are clear, certain things are empty that way, things have a place. If you're sitting in a cluttered, dirty home, it's just going to cause more anxiety. I thought this one was super interesting, is scent. It can really be effective in lifting up your spirits and triggering happy memories.
Yeah.
I have a very sensitive nose, so like strong florals and certain things can actually give me a headache. So there's things I will want to avoid my house to smell like. And then color. Make your house colors that you enjoy. It should bring you happiness, not cause anxiety. It's a personal preference. So for instance, for me, neutrals are very calming.
Yeah.
White, gray, beige, it might look kind of boring, but for me, it's calming. Creating a me time spot. So a safe place you can go in your house and decompress. If you're in a moment of high anxiety and you just need 10 minutes to do some deep breaths, find your place in your house that a comfy chair with your comfy blanket, or maybe it's your bedroom. You can turn your fan on, or this goes into mood lighting. Using your lamp to turn that on to kind of give you that light that you need, or maybe you don't need a lot of light and you want to be able to dim it. So things along those lines that can create that calming ambience. Okay, so these are resources from the research we did, if you wanted to look into any of those articles. Do we have any questions?
Yeah, some have come through. If someone is diagnosed with seasonal affective disorder, does that mean they have it for life, like every winter?
So, no. If you are diagnosed with seasonal affective disorder, there could be a lot of different things that play into that. Again, it could be what's going on in your life that year, in addition to some of those external factors that we talked about as far as the things that put you at risk, the colder season, lack of sunlight, all of that. And so you could experience seasonal affective disorder, one season, but then notice that maybe some other things in life change. Maybe you have found some good coping strategies. Yeah. You've implemented some of the things.
The next season.
Yeah, you've implemented some of the stuff we've talked about here today, like having a good routine in place, some strategies to help stay on top of it. And then you notice that the next winter you don't experience it. So no, it's not a lifelong thing, but that's a good question, and another reason why we bring up some of these tips to get ahead of it. I always tell people, if you know that in previous years you've struggled during the winter, you've experienced seasonal affective disorder, then that's a great thing to say, okay, as we're moving into the colder months, how can I stay on top of it?
Yeah.
How can I implement these things ahead of time? How can I make my home environment good for me? Have that lighting set up.
Set up my EAP.
Set up my EAP. And then you might find that, no, I don't experience it because I have implemented the things that we talked about here today.
I think we have time for one last question. What kind of indoor activities are effective in helping to lift a mood to combat seasonal depression?
Yeah, that's a great question. So I think, first of all, finding it's your personal preference. So if joining a gym is not for you, then like we talked about the mall walking, finding something that like maybe a club of some sort, a community center, your local church, finding somewhere that you can be involved with other people, getting that social interaction. If you're really wanting to increase your exercise, maybe water aerobics, something along those lines. But it has to be your personal preference, something within your budget. Maybe you don't want to be around too many people, so maybe it's a limited group. But finding something that works for you and trying to add that into your routine. Well, we don't want to go over and take your time, so if there are any more questions, this is our information. Please feel free to reach out to us directly. So thank you so much for joining us today. Our webinar next month will be hosted by our in-house registered dietitian and registered nurse, talking about heart health on a nutrition side and clinical side. So join us February 20th at noon. See you next time.
Thanks, guys. Bye.